Hi, everyone, and welcome back. Thanks for joining us. Today we're going to talk about how can we help break the cycle of addiction. Well, there is a new medication that has been approved by the FDA, and it's called Vivitrol. This is a whole new way to treat opioid addiction. With us today to talk about this is the president of CRC Health Group, which is the recovery division, the nation's largest substance abuse treatment provider. We have Jerry Rhodes with us today, the president of this organization. Jerry, thanks for joining us.
Thank you, Rochelle. Appreciate being on the show with you.
Well, if there are many people that can certainly benefit from today's talk, share with us a little bit of background about the CRC, if you could.
Yeah, Rochelle. We are the country's largest private provider of addiction treatment services. We have facilities throughout the country, approximately 140. We have inpatient and outpatient programs, and we have a capability to provide a wide array of services depending on the needs of the individual. An example, obviously, is, as you mentioned, is opiates, which actually requires some specialized treatment, particularly when one is detoxing opiates off of heroin or prescription drugs. And we actually have facilities that specialize in this area. We have facilities that will specialize in other drugs of abuse, and we have facilities that can provide a capability for both mental health services and addiction services, which is a significant problem for many folks as well.
Mm-hmm. It's evident that it seems to be a serious situation here in America when it comes to addiction. These are the treatment centers that are so vast, throughout our country. And I'm curious to know, let's talk about and I thank you very much for explaining about the organization, Vivitrol. Talking about this morning, about the FDA approval on this. When did that occur?
That occurred back in early October, and we're very excited about it. I would really like to applaud what Alkermes has done in terms of formulating Vivitrol, and the FDA, I think, recognizing the drug's potential as another tool to help addicts and those seeking services, another tool in the arsenal to fight addiction and help them.
Mm-hmm. And how would you explain that this works?
Well, Vivitrol is a substance that's injected by the individual once a month. It contains a drug called naltrexone, which basically prevents opiates from attaching to certain brain receptors. And that's obviously a very elementary view of what happens, but in essence, that is what happens. And because it's injected once a month, the individual is really saved, I think, the agony of having to make a daily decision about seeking help or medication. And I think this is going to be a significant help for those who really have no other choice at this point but to either go to a methadone clinic daily or to an outpatient program or even an inpatient program. I think it's a significant advantage being able to take this just once a month.
Mm-hmm. And this is the Vivitrol that we're talking about here, not only taken in the rehab setting, but can be continued when a patient returns to normal life in their own home.
That's correct. One could get this injection once a month of Vivitrol, and then obviously follow-up care. We would recommend that they continue to have counseling, but I think it significantly enhances their lifestyle, and we're quite excited about it.
Well, and certainly with good reason to be. And right now, about being excited about it, share with how many Americans today, statistically speaking, if you have the numbers, dependent on drugs.
Well,
what are those?
In total, the magnitude of the problem is very significant. There, depending on estimates, about 10% of the population, or roughly 30 million Americans, have an addiction issue or alcoholism issue. We're estimating that at least 16 million Americans age 12 or older, and these are federal government numbers, have abused prescription drugs or heroin in the last couple of years. So it's a very major public health and societal problem, and continues to grow. We think that actual prescription drug addiction is really the new heroin, and the growth of abuse in this area is really unprecedented. It's a very significant public health problem.
And what do you think is driving the increase in the use of opiate drugs?
I think the availability of drugs, and I think they're widely used, in many cases widely abused by individuals. I think in many cases they started off with a legitimate medical issue, pain issue, and were prescribed the medication. I think these are very powerful drugs. They have a tremendous potential. They have a tremendous potential for addiction, and I think oftentimes this is misunderstood by those prescribing them and those using them. So you have something that I think in many cases is not well understood, and the individuals probably don't have a good sense of how to take them and what the real risks are.
In the use of really trying to treat addiction, we haven't really heard of other medications that are available on the market. Why would you say there aren't more good medications to treat addiction to help people?
I think it has been an area that really hasn't been widely pursued by pharmaceutical companies. I mean, obviously different reasons for that. I think part of it is just of late, I think we've got to a point where we have a much clearer and better understanding of the biological basis for addiction, the chemical basis for addiction. And I think as we've come to that point, I think more and more research, I think, will go into this area, and I think that we will see, hopefully, new drugs developed to treat addiction in the not-too-distant future. But I think it's just been an area that's been ignored. Folks haven't realized, I think, the potential for the development of additional pharmaceuticals in this area.
Well, it seems as though it is a new field, pharmaceutical addictions, medications, opiate addiction. I appreciate your sharing this information with us today. As a parent myself and hearing of other stories with others talking about their kids, how would you be able to help the youth avoid lifelong addiction in the prevention of really raising awareness and informing them of why not to even start? And then there's the category of those who have already fallen to temptation and peer pressure perhaps. But how would you address this?
Well, I think you need to communicate and be very direct in terms of talking to kids and others about these drugs. I think oftentimes people believe because they've been prescribed, they have legal use, that they're safe, and somehow present a less threatening drug than, let's say, heroin. And in many cases that is true, but what happens is the fundamental, obviously the fundamental element of these drugs is they're opiates. And opiates are very powerful drugs. They I think, and again, they may have legitimate use, and people don't realize the potential risk in the abuse of these drugs and what I would call the addiction potential of these drugs. And in many cases, they're very powerful, and they can lead to addiction very quickly. And folks can have the best intentions in their utilization of these drugs or not have a clear understanding of the risks of these drugs. So because of their availability, because they're widely used, and I think because people feel they're legal in many cases, that they're somehow safer and they don't have this risk of addiction, and that's clearly not true. As I said, they really present the same risks as heroin, as other opiates.
And Jerry, I think you just hit right on it. If it's legal, it has to be safe. There's a number of people that kind of let that fall into that, their view there. And so I appreciate you taking the time today and sharing this information. We're talking right now. We have Jerry Rhodes, President of the Recovery Division of CRC Health Group, and leads our nation's leading provider of substance abuse programs with more than 140 facilities throughout the United States. I mean, that is evident. It is evident that there are certain many situations that you are addressing here. We're talking about opiate addiction. Vivitrol is the new FDA-approved drug to be able to help with that. Jerry, where can people find more information?
Rochelle, if someone either wants more information or needs help, I would recommend that you your website, www.seekhelpnow.com, or please call 866-575-8186. And we'd be glad to provide information or help anyone who may be in need of service or directed to a service.
All right, let's get the telephone number out one more time, please.
866-575-8186, or our website, which is www.seekhelpnow.com.
All right. Well, we're going to definitely be impressing that upon our listeners, and I appreciate you joining us, as I said again. Jerry, welcome back anytime. Thank you for all that you do and bringing this to the program today. We appreciate it.
Rochelle, thank you very much. I appreciate the opportunity to talk to you.
Oh, you're welcome. In parting, is there any last-minute thing that we have not yet addressed that you feel is...
Well, I would again just like to applaud the FDA and Alkermes for their development of this drug and the FDA's approval of this drug. I think it's going to be a game changer. I think it's going to allow an individual to make a once-a-month decision versus a 30 decisions in a month, and I think that's going to be a significant help, and we certainly welcome the opportunity to utilize this and help people. So thank you very much, Rochelle.
You're very welcome, Jerry. Thank you very much. And we will be back at this moment. Thanks for joining us, Jerry.
Thank you.